viewers and my fellow Imperial nurses. My name is Imperial Susan. I'm a medical student from Global World University. I am here to present a case study on the type of cancer. I am from Florence Nightingale Group. But before I continue, I'd like to acknowledge the presence of our course lecturer, Mr. Dr. Victor Efong, aka Healthy Prince, Wellness King, and our course reps and the other group leaders. Before I continue, I would like to take us to table of contents. We shall be looking at the meaning of testicular cancer, the symptoms, the causes, the prevention, the diagnosis, the risk factors, the treatment, and also the nursing care plan. Okay, before we go on looking at the meaning of testicular cancer, let's first know the meaning of cancer first. Cancer is one of the largest number of diseases that are characterized by the development of abnormal cells that divide uncontrollable and have the ability to infiltrate and destroy normal tissues. So now let's talk about testicular cancer. Testicular cancer is the growth of cells that start in the testicle. It starts when cells in the testicle grow out of control and crowd out normal tissues. The testicle, also known as the testes, are the scrotum. The scrotum is a loose bag of skin underneath the penis. The testicle produces a sperm and a hormone, testosterone. Testicular cancer is not a common type of cancer. It happens at any age, but mostly at the age between 15 and 45. The first sign of testicular cancer is a bump or lump on the testicle. The cancer grows quickly. They often spread outside the testicle to the other part of the body. Testicular cancer is highly treatable, even when it has spread to the other part of the body. Treatment depends on the type of testicular cancer that you have and each stage. Common treatment of testicular cancer includes surgery and chemotherapy. Let's now look at the symptoms of testicular cancer. The signs and symptoms of testicular cancer include the following: a lump or swelling on either testicle, a feeling of heaviness in the scrotum, a sudden swelling in the scrotum, a dull ache in the lower belly or groin, pain or discomfort in the testicle or scrotum, enlargement or tenderness of the breast tissue, and lastly, back pain. Usually, testicular cancer happens in only one testicle. So now let's look at the causes of testicular cancer. Um, you know, Actually, it is not clear what causes testicular cancer. Testicular cancer starts when something causes a change in the testicle, cause a change in the DNA cell of the testicle. A cell's DNA holds the instruction that tells the cells what to do. It changes tells the cell to grow and multiply quickly. The cancer go on living where healthy cells will die as part of the natural life cycle. This causes extra cells in the testicle that can form a mass called a tumor. In time, the tumor can grow beyond the testicle. Some cells might break away and spread to the other part of the body. The testicular cancer that's mostly spread to the other part of the body is the metastatic testicular cancer. Nearly all testicular cancer starts with germ cells. The germ cells in the testicle make sperm. It is not clear what causes a change in the DNA of the germ cells. So now let's look at the risk factors of testicular cancer. Number one of it is having an undescended testicle, which is also called the cryptorchism. The testes form in the belly during fetal development. They typically descend into the scrotum before childbirth. If you have a testicle that never descends, your risk of testicular cancer is higher. The risk is increased even if you have had surgery to move the testicle into the scrotum. The second one is having family history, which is heredity. When testicular cancer runs in your family, your risk of having testicular cancer is high. The third one is being a young adult. We say testicular cancer happen at any age, but it's most common in teens and young adults of age between 15, 35, and 45. The fourth one is abnormality of the penis and the urethra, which is hypospadia. Men who are born with the abnormality of the penis and the urethra, called the hypospadia, are more likely to develop testicular cancer. The fifth one is HIV and AIDS. People with HIV and AIDS have an increased risk of testicular cancer, but in most cases of testicular cancer are not linked to being HIV positive. You you usually have antiviral drugs to treat HIV and AIDS. Some evidence suggests that these drugs cancel the increased risk of the infection. Abnormal cells in the testicle, also called germ cell neoplasia in situ or GCNIs. The germ cell neoplasia in the germ cells neoplasia in situ means that there are abnormal cells in the testicle. It is not cancer. There is no lump, no symptoms. This is used to be called carcinoma in situ or CIS. Doctors think that most testicular cancer diagnosed after puberty develop from GCINS. If left untreated, GCNIS develop into cancer. Within 5 years, in about 50% of the men have it. Doctors might find and diagnose GCNIS when you have a testicular biopsy to check your infertility. You might have treatments such as radiotherapy or surgery to prevent testicular cancer from developing, or the doctor keep a close eye on you to check for any signs of cancer. Now let's look at the preventive measure, the prevention of testicular cancer. See, there is no way to prevent testicular cancer. If you notice any symptoms, if you notice that you have a testicular cancer, there is nothing to do to prevent it. So this takes us to the diagnosis of testicular cancer. You usually start by seeing your GP, your general health practitioner. They might refer you to a specialist or to a test. If you notice any symptoms that are related to testicular cancer, you can do the following tests: ultrasound, blood test, surgery to remove the testicle. So let's now look at the treatment of testicular cancer. Treatment of testicular cancer involves surgery and chemotherapy or radiotherapy. Treatment depends on the type of testicular cancer that you have and its stages. Your healthcare team also consider your overall health and your preferences. Now let's look at the nursing care plan for testicular cancer. We are going to look at two nursing care plans. We're going to look for acute pain and for anxiety. But first, we have to look at the nursing diagnosis first. Now, nursing diagnosis for testicular cancer. Acute related to the disease process, like suppression or destructions of nervous tissue, infiltration of the nervous supply system, the neural pathway obstruction, the inflammation. They are the side effects of cancer therapy. So now let's look at the goal of nursing diagnosis. Clients are able to control pain through activities, reported pain experience, follow the treatment program, demonstrate techniques of relaxation and diversion of pain through activities that may be. Now let's look at the nursing intervention for acute pain. Determine the pain history, location, duration, and intensity. Evaluation of therapies like surgery, radiation, chemotherapy, biotherapy, and also teach clients and family how to deal with it. Give transfer of such repositioning and fun activity, such as listening to music and watching TV. Recognize stress management techniques like relaxation techniques and visualization guidance. Happy and provide therapeutic touch. Evaluation of pain. Provide treatment if necessary. Let's look at the collaborative part of it. discussing pain management by physician and with clients, give analgesics as indicated. Let's look at the rationales of the nursing intervention. Provide information needed for the planning to find appropriate therapy is carried out or not, or even complications. To enhance self-control over side effects of lowering stress and anxiety. To find out the effectiveness of pain management, pain level, and to what extent the client is able to hold him and know the needs of the client will be anti-pain medication in order for a therapeutic target to overcome the pain. Let's look at the second one, which is nursing diagnosis for anxiety. Anxiety. Anxiety related to the crisis situations like health change, social economics, the role and function, form interaction, preparation of death, separation of families. Now let's look at the goals of this nursing diagnosis for anxiety. Clients can relieve anxiety, relax and able to see himself objectively, demonstrate effective coping and able to participate in treatment. Now let's look at the nursing intervention for anxiety. Determine the client's experience prior to the illness. Provide accurate information about the prognosis. Give the client an opportunity to express anger, confrontations. That is, give reasonable information to the emotions and expression accordingly. Explain the treatments, the purpose, and the side effects. Help clients to prepare for treatments. Note the ineffective coping such as lack of social interaction, helpless. Encourage to develop interaction with support system. Maintain contact with clients. Talk and touch with fair. The rational part of it is that data about previous clients' experience will provide a basis for counseling and avoid duplication. Provision of information to assist clients in understanding the discussion process. Anxiety, clients can reduce anxiety, assist assist clients in understanding the need for treatment and the side effects. Um, Knowing the client's coping pattern and explore and resolve or provide a solution in efforts to increase the strengths dealing the strengths to increase the strength in dealing with the anxiety. So the client gets the support from the nearest person or family, providing the opportunity for the client to think, contemplate, and rest. With this, clients gain the confidence and believe that he is really in for help. With this, we have come to the conclusion of the nursing care plan for testicular cancer. I hope and I thank you all for paying attention and watching me. Thank you all.